Hi, this is Dr. Fedorchenko, addiction psychiatrist from Dallas, Texas, and today I want to talk about substance intoxication. Most of us intuitively understand what intoxication means. Remember that time you had too much wine, slurred speech, unsteady gait, poor attention. These are some common symptoms of alcohol intoxication in particular. But to diagnose it as a disorder, several other things have to coincide. Let's take a closer look. These are the general criteria that help us diagnose substance intoxication. First, syndrome has to be reversible. That is, everything goes back to normal once the substance is processed and eliminated from the body. This syndrome is substance specific. Indeed, alcohol intoxication looks differently from, say, cocaine intoxication. Ingestion has to happen recently enough for us to think about it as an intoxication syndrome. What is recent enough? For some substances we know better than for others. For alcohol, we can measure the blood level, and this can help us correlate how far back and how much a person has consumed. Of course, just asking a person and correlating time of ingestion with the half-life of a substance will also help. Half-life is just the time that it takes your body to decrease the concentration of a substance by half. Second criterion, clinically significant changes. What does that mean? Generally, this is when the changes in behavior require attention of a medical provider. A glass of wine during dinner would most often not cause significant enough changes, and hence would not be diagnosed as an intoxication. And yes, whatever changes happen, they have to be due to the effects on the central nervous system. Alcohol, for instance, affects practically every tissue in the body, but we are interested in its effects on the nervous system. After all, psychiatry is about brain. Specific symptom set. Every substance creates a distinct behavioral and psychological pattern of intoxication. Recognizing these patterns help us with the diagnosis. For instance, for alcohol, these include slurred speech, incoordination, unsteady gait, nystagmus, impairment in attention or memory, stupor or coma. Nystagmus is just an involuntary movement of the eye. Most common type is when the eye moves slowly in one direction and then quickly moves in the opposite one. Say the eye slowly moves to the right and then quickly returns to the left. That's nystagmus. So, one or more of these symptoms might indicate intoxication with alcohol. Finally, we have to make sure that whatever is going on with a person is not due to another medical condition or mental disorder. There is no reason to make things more complicated than they are. Here is an important note. Physiological intoxication is a broader term than substance intoxication. When a biologist measures the effects of any given substance, they are looking for some change. For instance, a person develops tachycardia or an increased heart rate. Now, that might qualify for a physiological intoxication, a particular effect of a substance on a body tissue, cardiac tissue in this case. But isolated tachycardia would not be considered an intoxication syndrome. Why? Remember the four criteria? There would not be any clinically significant behavioral or psychological change, and hence we would not make a diagnosis. Not every ingestion equals intoxication, and not every intoxication equals a disorder. This was substance intoxication. Thanks for watching, and see you next time.